This is Autumn. She's 4. She has Lennox-Gastaut Syndrome, which is a severe form of epilepsy. When she was born, she was without oxygen, didn't have a heart rate for 11 minutes. They worked on her. Doctors didn't know what to expect from her. They kind of wrote her off as being a vegetable, not having any quality of life. When we first brought her home, she was having 50 to 60 seizures per day. When she wasn't having seizures, she was sleeping because she was having the seizures, and then she was also sedated because of the pharmaceutical medications that she was on. So she wasn't able to learn, she wasn't able to progress, go through any of her developmental milestones. While we were there, she was on multiple different seizure medications. Everything that they gave her made the seizures worse. I had doctors coming in telling me that we needed to put her on palliative care, that she was not going to have any quality of life at all. My goal at discharge was to avoid the hospital at all costs and to give this girl quality of life. Since starting medical cannabis, she typically has 1 to 2 seizures a day. She was originally on 4 seizure medications. Right now she's on 2, and we've got 1 of them just about halfway gone. It's healed her brain, it's healed her stomach. She had horrible, horrible acid reflux. She's been off of her acid reflux medications now for almost a year. And doesn't have the vomiting, doesn't have the stomach pain, the crying. It's just amazing. Autumn definitely needs more THC. I think I would see a huge change in her development and her growth and her seizure control if we were able to get more THC. When she came to me, 3 years ago, I didn't know if she was going to even live. We were at that point, in her progress, that we didn't know if she was going to make it. If you would have asked me 4 or 5 years ago as a nurse if I would be advocating for the use of medical cannabis, I would be like, absolutely not. There's medications out there for that. But learning everything that I've learned and seeing what it does for these kids has just changed everything in my mind. I would just like to say thanks for listening to our story, your compassion, your support, your continued support, and doing what you can do to help us.
Thank you so much, Anya.
Thank you.